Hello,
Yeah.
doctors, students
Yeah.
of homeopathy, and friends of homeopathy. Today is the 1836th day of uninterrupted daily webinar of IFPH. Today, our speaker is Dr. Hubert De Silva, Chief Physician, Homeopathy Clinic, Karakutam, Thiruvananthapuram, Kerala. He do have 35 years of clinical experience, and we don't need any introduction of him because he is the moderator of IFPH. And it is the 8th part of the series, which he is being taking management of neurological disorders with homeopathy, 8th part. Let me welcome Dr. Hubert De Silva for the session, and I welcome you all for the session.
Thank you, Dr. Thank you, Dr. Vindraj. Can you hear me?
Yes, sir.
Okay. Thank you very much, Sahanisa, and all the guys. Now, this is the 8th part of neurological disorders. Let me share my screen.
Sure.
Galatians, this is from scriptures. If you think you are something when you are really are nothing, you are only deceiving yourself. If you think you are something when you are really are nothing, you are only deceiving yourself. You should each judge your own conduct. It is good. If it is good, then you can be proud of what you yourself have done without having to compare it with what someone else has done. We are always thinking about ourselves that we are something that normally happens anywhere in the world. Even the greatest person and the smallest person in the universe thinks that he is something. But whenever this world is going on, each and every time, when we are very small, in our younger ages, we will think that we are something. But each and every day coming, going to our old ages, then we will understand that we are nothing. That is what is happening in our day-to-day life. That time we will think that something is carrying us or somebody is leading us. Whenever it understands that the reality, that time we will go in the right way, right path. Once in Bhagavad Gita, in the 11th chapter, while Krishna shows the universe to Krishna and he showed the future, what is the future is coming in front of him. That time Arjuna understands that, hey, they are all killed. Krishna, Lord Krishna, these are all persons are killed. Then that it is the future. This already happened. It is in the mind of the Lord that they will be killed in the future. But what you have to do is you have to do the war. Whenever a warrior in the war front, the person should do war. As a warrior, you must act. The rest of the things are all by the grace of God, everything is happening. We are traveling through all these ways. Now, neurology, we know that nervous system. It is a wonderful, whenever we're thinking about the nervous system, each and every time we will be astonished, embarrassed. Let us see, these are the 12 pairs of cranial nerves. We learned in our second year and first year and second year in the medical college. Cranial nerves. This is the most important parts of our body, the neurological nerve system. 12 nerves, 12 pair of cranial nerves, which we can see that the cranial nerves around our face and our head. That is olfactory, first nerve, second optic nerve, third oculomotor nerve, fourth trochlear nerve, 5th, trigeminal nerve. 6th, abducens nerve. 7th, facial nerve. 8th, vestibulocochlear nerve. And 9th, glossopharyngeal nerve. Then 10th, vagus nerve. 11th, accessory nerve. And the 12th one is hypoglossal nerve. These are the nerves, nervous system. It is under the base of the brain. We can see the lower part of the brain. These are all doing our day-to-day life, each and every nerve, which is acting, and it all makes our life beautiful. Otherwise, without anything lost, means that our life is a miserable one. The first one is the olfactory nerve. Olfactory nerve. Can you see all these pictures? Okay.
Yes, doctor.
Olfactory nerve. Now, these are all the nervous system, the cranial nerves, which are acting our superior part of our body, that is our brain, our head. These are the important one. Today we are talking about the olfactory nerve and its action and all its functions. And what are the medicines? These are all acting on this, our homeopathic medicines, which can do what are the wonderful things. A network. How beautifully these are all created. Our eyes, our nose, our face, facial nerves, and everything. These are all concentrated with this area. If we get a hit on the back of the head, we call it as marma. It may, most of the activities will lose. If we get a blow on the head, every injury of the head injury is considered as a serious one, whatever it may be, a small one or a big one. According to medical science, any head injury is a serious one. So we have to keep. That is why while we are riding a motorcycle, we have to keep a helmet. Otherwise, any small bit on the head, it may affect our life. First cranial nerve. Courtesy of your olfactory nerve is the first cranial nerve. It is the part of your autonomic nervous system, which regulates body functions. This nerve enables your sense of smell. Cranial nerve one is the shortest sensory nerve in your body. The shortest cranial nerve one, or the olfactory nerve, is the shortest sensory nerve in your body. Sense of smell. Have patient identity sent with eyes closed. We can remember, if I say that orange the fruit, you can remember the smell of the orange. Whenever I say that a rose, a flower, you can remember that. That may be like this. If a bad smell coming, some mouse dead and destroy, there is some creature damaged, that time we will get some faulty smell, foul smell. That time we can understand that something had dead. There may be a dead body of any animal or anything like that. Each and every smell we can remember from our life. throughout our life, we are always smelling. Whenever coming a good smell, we will be happy. Whenever coming a bad smell, you will feel that you are very much distorted that, that smell. If we are living in a smelly place, a foul smelly place for a long time, we cannot understand that. Somebody will come to that place and say that how you can live here. See, how you are living here. Oh, foul smelling is coming. Always you are sitting in the place. That time we are used to that smell and we are living in that place. That is another factor. Once a fortune teller told a person that your life will be a miserable at the age of 35. Till 35, your life will be very much miserable. Then that person asked the fortune teller, after that, how will be? That time he said that you are used to all these things. So you live the same thing, live the miserable thing, you will live. The same life will be, but you will not be affected. That is how a person living, we know that sometimes there may be congenital smell disorder, olfactory nerve having some congenital by birth. That person will not get the smell of bad smell and good smell. His life will be like that. But some people, all of us, most of all of us, having that capacity to understand the smell of we will get the smell, good and bad smell. But we know that in the COVID time, that was one of the important symptoms while they having COVID, that person having loss of smell. If we get a good food, a tasty food, we know that the smell of that, our brain will be happy and we will get a happy mood whenever he smelling some good smell of food, good smell of flowers, good smell of perfumes. And in the creation of man, it is said, I heard that in the creation of man, man was very much smelly, having good smell. But living bad, after that, we will get destroyed and decayed and smelly body. So we had to regenerate it. That is what homeopathy says, that the regeneration. We have to bring back whatever we lost, our qualities, our faculties, our body faculties. We have to bring back that is with homeopathic medicine, it is possible. So let us go to other part. What is olfactory nerve? The first nerve. The olfactory nerve is a pair of cranial nerves. Two nerves are there. They transmit information from smell receptors in the nose to the brain. Nostrils are either of two external openings of the nasal cavity. The septum separates the two chambers of the nose. It is a thin bone and cartilage wall. Sinuses are hollow, air-filled chambers in the bone surrounding the nose. We have every day, we will get patients. They having problems of nose because through this nose, every atmosphere coming into our internal atmosphere, internal body. There is two atmospheres there, outside and the inside. There is an atmosphere inside our body and external body, external part. our body having some, we will accept something and we will expel something. We will take something and we will push out something. That is what we are happy. We know that whenever we are taking air, from the air, we will receive the oxygen and we will reject or push out carbon dioxide from our body. There will be nitrogen. Most of the atmosphere is nitrogen. But even though we will not receive that nitrogen, whatever needed is only we will take. So through this nostril orifices, we take breath. Like yogis, if they are practicing yoga, the normal breath, our breath is 18, we know that 15 to 18 per minute. But whenever we are practicing yoga for a long time, we can reduce the oxygen level. We can reduce, it is enough. A few oxygen is enough for to live. That's how we can make our body more and more useful. A less amount of oxygen is enough. Otherwise, we need more. Whenever lungs is not perfect and there is any diseases, that time we had to always take more breath, and that time if our body is not oxygen and there is any problem in the lungs and other blood, that time we have to take more and more oxygenated. We needed more oxygen for us to maintain the life. So we know that first thing, whenever we are studying about upper respiratory tract, first we have to check a patient having any obstruction in the nasal orifices. If there is a nasal orifice, there is nasal polyp or any obstruction. That means if the nasal orifices is becoming smaller, the percentage of air intaking will be lesser. If it is continuing for a long time, that person will be a sick person. Most of the cases, we are not noticing it. We have to notice how that oxygen or the air passages are normal or abnormal. If that is normal, and then only we have to check the obstruction. There may be different types of obstructions are there. One, I told you, nasal polyps, adenoids, mucus, production of mucus in that area. If there is eosinophil count is higher, that means that the permeability of the skin of inside the nasal orifices will be more permeable, soft, and it become inflamed. That time, inflammation of the nasal orifices, there will be only a few air we can take. That time, the metabolism will be changed. All our body will be affected if the nasal orifices are not perfect and not as required amount of air is not taking. That time the whole system will be in a worse condition. It will become each and every time it will be more. That is why whenever we are checking a person, that time first at least we have to check the nasal orifices, and the other thing is the tonsils inside the throat. If the tonsils are pushing other parts of the area, there is chances of less oxygen or air intake will be lessened. Okay. We can see that nasal olfactory nerve fibers and bulb, eye These are all bones, facial nerve, trigeminal nerve, trochlear nerve, oculomotor, everything. So, in a short area, whenever we are dissecting a body, while I saw this area, that time, when I studied my physiology, that time I used to study, self-study I made. That time, I was studying for pituitary gland for a long time. The pituitary, you know that pituitary gland is having many functions. After learning all these things in the dissection hall, our professor told me to open the brain. That time, I am a healthy person that time. So he called me to, you open that skull. And I opened it and I saw that pituitary gland. I was impressed that this is like a size of a pea. Small, very small. Pituitary gland is a very small gland, and this is controlling all the whole body, our whole body. There are so many hormones are generating from it, coming from the pituitary gland. How it is possible? How the God created this pituitary gland itself will make a person a believer of God. Even the atheist, the most topmost atheist will be becoming a believer after seeing the pituitary gland alone. And these are all the things, how God is created. He is the scientist, the great scientist, God, the creator. He made all these things in a beautiful way. How beautifully it all created the brain and all this. You see how beautifully that is arranged inside the brain. What is the anatomical course of the olfactory nerve? The anatomical course of the olfactory nerve describes the transmission of special sensory information from the nasal epithelium to the primary olfactory cortex of the brain. Nasal epithelium, the sense of smell is detected by olfactory receptors located within the nasal epithelium. Why God is not created the nose bigger? Why there are some controlling areas? Why there are hairs? If it is opened, then something will enter. Easily it will enter. That is why there are guards are there. Some guards, hairy guards, small guards, and becoming shrinking and expanding, shrinking and expanding, shrinking and expanding. Sometimes one nose will be more affected, more working, the other will be closed. Sometimes the other will be opened and the other will be closed. That is alternatively doing the things. Each and every time, this all happening. We know that the nasal epithelium, through that nasal epithelium, all air is somewhat. If there is any impurities there, it will absorb that. And the hair will protect them, protect the nasal orifice. We can see the bulb. Olfactory nerve damage and treatment. The olfactory nerve, also known as cranial nerve 1, is a unique sensory nerve responsible for the sense of smell. It plays a role in detecting and processing odors, allowing humans to perceive and distinguish various scents. Beyond approaching pleasant aromas, smell acts as a warning system. We know that in the kitchen, if the gas is leaking, if we have any defect in the nasal orifices or the nerve, the cranial nerve, we will not understand that gas is leaking. That time, very dangerous. So if we get the gas smell, we will understand that, there is some gas leakage, then we will close the gas. Smell acts as a warning system, alerting individuals to dangers such as gas leaks, smoke. If our food is frying, that time if there is some smoke is coming, then we will understand that it is going damage or destroying, or it may will be useless. That time we will be more alert. Gas leak, smoke, or spoiled food. We can understand that it is a spoiled food because it is coming from it, then foul smell. Then we will understand that that food is not right and it is dangerous to take in. This chemosensory process also influences memory and taste perception as much as flavor is derived from smell. We know that our memory will have all these faculties. That smell and the faculties of brain will understand that what smell is coming. If we have to do, there is an alert. So the alert will be much more helpful us to lead a normal life. What causes olfactory nerve damage? These are the main problems, the main things that may nerve damage of olfactory nerve damage. That is the first nerve. Head trauma is a common cause of olfactory nerve damage. Injuries like concussions or brain fractures can directly damage the sinonasal tract of olfactory epithelium or shear the delicate olfactory fibers as they pass through the cribriform plate, a bone structure separating the brain from the nasal cavity. This can impede the connection to the olfactory bulb, leading to smell loss. Contusions means some hit on the head, or hemorrhages in the olfactory cortex. The brain area for processing smell can also damage tissue inhibiting olfactory processing. So whenever taking a case, we should ask if there is any smell loss. It is a very important thing. Most of the cases, we will neglect it. We should not neglect it. We have to take it more seriously. Then we have to ask them whether there is any having injury of the brain or head. These are all interconnected. Olfactory nerve damage causes symptoms and treatment. The olfactory nerve, also known as cranial nerve 1, is a unique sensory nerve responsible for the sense of smell. It plays a role in detecting and processing odors, allowing humans to perceive. We can understand that. We have to distinguish that smell and distinguish the various scents. Beyond appreciating pleasant aroma, smell acts as a warning system, alerting individuals to dangers such as these are all said. This chemosensory process also influences memory and taste perception as much as flavor is derived from smell. If we will not getting the smell or the odor of a good food, we cannot enjoy it. If the food having a good smell, we will enjoy it. I heard that once a cook told me that we will put some smell to get good odor in the hotels. While preparing their food, they will add something for the to get a pleasant smell for those who are going there and here and then. If frying a chicken, they will add something. Only they will take 20 pieces and some good smelling particles they will add to the food and fry the 2 pieces of chicken. That time the smell will go throughout the whole area. Somebody will be attracted and they will take the food, and the other chicken pieces, they will not use it. They were smelling from the atmosphere, the smell, and they are taking the food. That is why whenever we are buying some food from the hotels, if we are taking to our home, the food will not have the smell, the good smell. That is only that atmosphere. They are creating that atmosphere having the smell, and we are taking the food in the hotel. It will be very smelly, pleasant smelling. Whenever we are buying it and taking to our home, the smell will not be there because they are creating an atmosphere for a good smell. And in our home, that smell will not be there, but the food will not have the taste. So we have the mechanism. This is the chemosensory process also influences memory and taste perception, as much as flavor is derived from smell. Then a trauma. It's already been discussed. These are some of the conditions. What are the smell disorders? One, people who have smell disorder either having a decrease in the ability to smell or changes in the way they perceive odors. They cannot understand. Hyposmia is reduced ability to detect odors. Hyposmia means is a reduced ability to detect odors. Anosmia is the complete inability to detect odors. In rare cases, someone may be born without a sense of smell, a condition called congenital anosmia. I told you earlier, that some having during their birth itself, they will not have the quality. They don't have the power to understand the things. Hyposmia is a reduced ability to detect odors. The odors, if it is a strong odor, some people may have the greatest level. They will get more smelly. But some person having that smell, they will get the smell, but only a part of it. They will, it is quite okay. But the other person will say that, oh, how smelly. It may happen. One of our medicines having that, Stanamet is a medicine having that. Some medicines having, they will feel that the smell more. Anosmia is a complete inability to detect odors, complete disability. In rare cases, someone may be born without a sense of smell, a condition called congenital anosmia. Parosmia is a change in the normal perception of odors, such as when the smell of something familiar is distorted, or when something that normally smells pleasant now smells foul. That is another thing. It says change in the normal perception of odor. We will understand that. What means the perception means understanding the smell, the quality of the smell or the whatever it may be. But in such cases, some cases, parosmia means they will understand a different thing. That is what we call as parosmia. Then phantosmia is the people having some like delusion, we will say that delusion. That is inside in the smell, that time they will feel that some smell that may be due to some memory from them. They may have some memory of smelling. That is why they are saying that some other people will not say that there is no smell, but they will say that, if they will say that urine, the smell of urine is there, smell of urine everywhere. In the old age, they may have such illusions because sometimes they may have some leaking of urines. Whenever they go anywhere, they will get the smell of their own urine. So they say that somebody is urinating everywhere. The smell is coming from itself. That is why I told in the starting point, we should not judge. We have to judge ourselves. We have to judge ourselves. Sometimes we may blame others. That will be a wrong thing. So we have to judge ourselves. That is what always we have to do. And that time we will understand that we have more and more problems. So we can correct it. What causes smell disorders? Smell disorders have many causes, with some more obvious than others. Most people who have developed a smell disorder have experienced a recent illness or injury. Common causes of smell disorders are aging. These are the common causes of disorders. Smell disorders are: 1, aging, sinus and other upper respiratory infections. Sinusitis, we know that sinusitis, during sinusitis, they will have foul smell. What are the medicines? Phosphorus, Syrutia, Stanamet, Belladonna. These are for aging. Smell disorders: selenium, phosphorus, natramor. Smoking. Smoking is another reason. They are smokers, heavy smokers having that problem of smell disorders. Growth in the nasal cavities, maybe benign or malignant tumors, cancerous tumors, and the inflammation of adenoids, polyps, and the mucosa, damage of mucosa are all may produce. Then head injury. These are all the common disorders of smell disorders have. Hormonal disturbances, other things. Dental problems, decaying of dental caries. These are all can make, they will affect the trigeminal nerve. And trigeminal nerve, we know that trigeminal nerve of the head and the buccal cavity and the areas of the face. It may be one of the recent dental problems. Exposure to certain chemicals such as insecticides and solvents. Insecticides and solvents. Sorry. Then another numerous medications, including some common antibiotics and antihistamines, radiation for treatment of head and neck cancers, conditions that affect the nervous system, such as Parkinson's disease or Alzheimer's disease. These are the diseases may cause smell disorders. What research is being done on smell disorders? What we needed is to promote the regeneration of the sensory nerve cells. We know that after COVID, we got, in every cases, we are cleared. We know that we doctors, all are treated COVID cases and all are success, and we done very wonderful job while doing the COVID-19. Understand the effects of environment such as gasoline, chemicals, and extremes of humidity and temperature on smell and taste. Prevent the effects of aging on smell and taste. Develop new diagnostic tests for taste and smell disorders. These are needed. Understand associations between smell disorders and changes in the diet and food preferences in the elderly or among people with chronic illnesses. If the food is not some person may have taken some food, it may produce some problems. Gastric problems. Some, if we are taking some people taking curd, some people taking wheat, some people taking cereals, dals, and these are all causes. In each and every person, different symptoms. That time, it may produce some chronic illnesses. That chronic illnesses may also reason. Viral infections are another frequent causes. Viruses, including those responsible for the common cold, influenza, SARS, COVID-19, and the cranial nerves related to smell on the surrounding mucosal tissue. In COVID-19, the virus can indirectly affect olfactory receptors by triggering an immune response that alters the genetic activity of the olfactory nerve cells. And these are all produce so many damages to the person. This can reduce the genes needed for building new receptors. Another thing, neurological conditions also contribute to olfactory nerve issues. Neurodegenerative disorders such as Parkinson's and Alzheimer's disease, frequently present with impaired smell, often appearing before other symptoms. Multiple sclerosis can also affect olfaction. So, in some person having smell loss, that time, if they are old, we should think about Alzheimer's or Parkinson's disease. How common are smell disorders? Your sense of smell helps you enjoy life. You may delight in the aromas of your favorite foods or the fragrance of flowers. Your sense of smell is also a warning symptom, alerting you to danger signals such as gasoline, spoiled food, or a fire. Any loss in the sense of smell can have a negative effect on your quality of life. Our quality of life will be in a negative condition. It can also be a sign of more serious health problems. Exposure to certain toxins or medications can impair smell, environmental chemicals, and all this. Then age-related viral infection, environmental insults, as well as structural inflammatory changes in olfactory epithelium stem cells with aging may also disrupt normal maintenance. These are the common problems. Neurodegenerative diseases, certain neurodegenerative diseases, then allergic rhinitis, olfactory nerve tumors, respiratory infections. See, good smell from flowers. There are Diagnostic olfactory. Treatment and management. Treatment for olfactory nerve damage depends on the underlying cause. We have to understand the cause. What is the cause? The damage there. If after a hit on the head is having that condition, we can use arnica, Bellis perennis, hypericum, one of the main medicine. Then Bellis perennis, I told, Stanomet, calcarea carp. This due to any injury on the head. Sometimes there is poisonous effects. Nexomica itself come with great help. Natromur, commonly we can use. Syritia for damage of any internal part, or there is any damage or injury or any decaying of in the nasal orifices or in the respiratory tract or in the mouth or in the gums. That time, Syritia, higher potencies. Syritia, higher potencies. 1 nam, 10 nam. If there is in the ears, there's some, we know that as some acute suppurative otitis media or chronic suppurative otitis media, that time, Syritia 1 nam, Belladonna, Macphos. In some cases, Heparself. Heparself, higher potencies, not lower potencies, higher potencies. Syritia is a wonderful medicine. It may remove it. Then another medicine is Calcarea picrata. Inside the ears, if there is any small pustules, very painful pustules, that time, Calcarea picrata is a wonderful medicine we can use to absorb the pus. Syritia, higher potencies, and Calcarea carp is much helpful. For inflammation, we know that they have intranasal glucocorticoids and systemic corticosteroids. They are using steroids, and that time we can very much useful. All these medicines we have in cases of nasal polyps or chronic sinus problems not responding to medication, surgical intervention may be considered to remove obstructions and bestow. In nasal polyps, we can use Tucrium mother teacher for application, and Calcarea floor and Calcarea carp. Then another medicine. Sanguinaria groups is helpful. Sanguinaria groups. Pulsatilla, lower potencies are 30 or that potencies, and high potencies we can use. And sanguinaria, there are some sanguinarias and Mercor, Mercsol. These are the medicines for chronic complaints of nasal orifices or inside the nasal polyps, and there is any infection. Then another medicine is pyrogen. Then epismen. These are the details. Let us go to our materia medica. Syritia for nose. Itching in the point, nose, dry, hard crust form, bleeding when loosened, nasal bones sensitive, sneezing in morning, obstructed and loss of smell, perforation of septum, nasal septum, perforation. Second, this is phosphorus nose, fan-like motion of nostrils, bleeding, one of the most important medicines for bleeding, epistasis, bleeding epistasis instead of menses, oversensitive smell. They are I told you that smell, there are more oversensitive. Periostitis of nasal bones, periostitis, that's inflammation. Fall imaginary orders. Phosphorus number one medicine. Chronic catarrh with small hemorrhages. Handkerchief is always bloody. Polyp, bleeding easily. Phosphorus, this is phosphorus. Then Medorina. Intense switching, coldness of tip, posterior nase obstructed, chronic nasal and pharyngeal catarrh. Chronic nasal catarrh, Medorina. Another one, Natramore, I already said. Violent fluid coryza, lasting for 1 to 3 days. When changing into stoppage of nose, making breathing difficult. Discharge thin and watery like raw white egg. Violent sneezing coryza, infallible for stopping a cold commencing with sneezing. Use 30th potency. Here it told that the 30th potency. Loss of smell and taste, internal soreness of nose, dryness, anosmia. Then Pulsatilla. Coryza, stoppage of right nostril, pressing pain at the root of nose, loss of smell, large green pitted scales in nose, stoppage in evening, yellow mucus, abundant in morning, bad smells, as an old catarrh, nasal orifice. We can see that these are the Pulsatilla and Silicea we can use at the same time. And another medicine, Calcarea sulph. I forgot to say that. Calcarea sulph, an important medicine for sinusitis and everything. Lower potencies, same time we can use the lower potencies and the tissue remedy and the medicine. Now, anacardium. Anacardium is also involved with the memory of the smell. Anacardium, nose frequent sneezing, sense of smell, perverted smell, coryza with palpitation, especially in the aged. I think that, let me stop here. You can ask anything, please ask me. Thank you. Thank you for hearing.
Thank you, Doctor. And it's time to interact with the speaker. Participants can raise their hand.
Only a few minutes.
Only a few minutes left. So we had some insights on hyposmia, anosmia, phantosmia, a lot of things related with olfactory nerve complaints. And a lot of medicines also is being mentioned by Dr. Hubert De Silva.
Please, Dr. Bidra sir, you have any experience, please? You are a single medicine person. I am not a single person, but a medicine person.
No, sir, that's not the right thing, because homeopathic medicines are all tools, and each doctors do have their own type of affinity in dealing with cases. They can use their tools accordingly. And if I am reaching the case, I'll go for the totality along with this common symptoms, and the presenting symptoms will be a must to get relieved. But I will go for the constitutional approach also, or the exciting factor. What complaint triggered should be given more importance. I think Dr. Rampravesh Shah is with us. He need to ask some questions or he need to interact. Doctor, please. I think.
Thank you,
Yeah.
Dr. Binduraj ji, or congratulations, my dear Dr. Subhat De Silva ji. Very nice, excellent presentation. Olfactory nerve. Olfactory nerve, the very essential nerve, are very good remedy repairing of olfactory nerve. Silesia is the best remedy.
What is that?
And
Pardon?
Silesia, silica.
Hmm.
Silica is the best remedy. And intercurrent remedy, according to me, are bacillum. 200 1 1 dose monthly, yet to very good action of olfactory nerve. So very thanks, Dr. De Silva, sir.
One more medicine. I forgot to say one more medicine, which is the most one is tuberculin. 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 Yeah. I forgot to say about it.
Tuberculum or bacillum, the both
Bacillum.
bacillum, tuberculum, the very reaction. Very, the bacillum is the best. According to symptom, totality of symptom, select remedy. So very thanks,
Thank you,
Dr.
Doctor.
De Silva.
Thank you. Thank you.
Thank you. So, selecting with the by selecting the right medicine, hitting the bullseye, we need to correct these problems, and it's time to conclude. We will have another session with Dr. Hubert De Silva that we can interact with him more on that session itself. So, on behalf of IFPH, I thank Dr. Hubert De Silva for this session, and I thank all for here who presented for the session. Over to Dr. the Malayalam session.
Thank you, Doctor. Thank you, Dr. Rampravesh sir. Thank you, Binduraj sir.